In Hometown, we've got a business partner program, and we developed this business partner program as a product of doing strategic plans in the early 2000s. Our background has been in strategic planning for many industries, and what we saw was in the rural hospitals especially, there was a need to have a plan. We started helping them develop a plan, and out of that plan there became the identification of problems, which then needed solutions. So we went about finding solutions to the many problems, and today we have at least 50 different solutions that are operational solutions for these rural hospitals, and to that end we brought in the solutions in the form of business partners. Very important differentiation, because as business partners we do not view them as vendors. We view them as equal stakeholders in the operation of finding problem solving for our hospitals so that we can help our hospitals to stay alive. Our approach to business partners is that we create what we call a relative degree of exclusivity, and that is, for the most part, we do the due diligence for our particular member hospitals, and then bring an interesting quality control to that process in that by comparing notes throughout our membership, we can always be aware of how well they're performing. We can bring price competition to the table because we can bring volume. We can ensure that quality is maintained the same, and as much as anything, we can provide them with a network of provider hospitals who need their services, who talk amongst themselves and share these solutions. In addition to that, the Business Partner Program does an excellent job of providing forums twice a year for the business partners to be able to talk to each other. And if there's great opportunity in business for those people talking to the hospitals, there's at least that good of an opportunity for those people talking to each other in those forums and otherwise. So essentially what we've done is we've created, through the membership in Hometown, accessibility to proven, known, highly due diligence solutions that can in fact contribute to the survival of these rural hospitals, which is so difficult in these particular times. So results have been phenomenal, opportunities are great, and our business partners are most appreciated for what they bring to the table, particularly in the form of a business partner and not a vendor.
You know, we feel like our business growth is 100% based on our affiliation with Hometown. In 6 months of affiliation, we are set to more than triple our business, strictly from the connections and help we've had from Hometown.
There's no other group out there in the United States that's like Hometown. I mean, they're unique in their approach to business partners, involving exclusive business partners with the hospitals itself.
Well, obviously it gives us access to a market that may be difficult to get into otherwise. I think it also exposes us to a lot of people who might be able to give us a perspective that we might not have seen, give us the opportunities that we might not have seen ordinarily, get introduced to people who we can work together with. You know, we've spent the day talking about business partners, and you know, they really are our business partners too in a lot of aspects. There's some competitors in there, but we all get along. We try not to keep the fights inside the building. We try to take them outside.
I think the rural hospitals need the resources, and so having the resources available and having the resources know each other, like the business partners having connections with other business partners, so that you know what resources you can say to the hospital, this is what I think you need to do. So the Hometown Health network of business partners is very important.